Thank you so much. Thank you for coming. We are keeping attendance, so we gold stars all around here today. So thank you so much. Uh, Vice Chair Lieu and I are joined by two amazing new members who joined in the 118th Congress, Glenn Ivey from Maryland and Jill Takuda from Hawaii. I asked them to come and share how their community has been impacted by the Affordable Care Act. These members ran on healthcare and the Affordable Care Act in our communities. More than 16 million Americans have health insurance from the ACA, a record high. And today is the 13th year anniversary of when the Affordable Care Act went into effect. This law has become the most endearing, most popular, and one of the most impactful pieces of legislation in a generation. Though we hope that its rival in impact of the Inflation Reduction Act and the Bipartisan Infrastructure Law and the American Rescue Plan that were passed in the last Congress will likely carry the mantle of being popular, effective, and helping people. I came to Congress. Ted and I came to Congress in the 115. What was the number? Sorry, in 2015. And both of us with school age kids from California, and the hot Republican rhetoric at the time was the effort to repeal and replace. And it was getting underway, and it didn't amount to anything legislatively because the real tangible benefits of the ACA had been felt in our communities and across this country. However, that didn't stop House Republicans from continuing to try to dismantle the Affordable Care Act. And now they still want to continue that discussion. And they want to use the debt ceiling to weaken the Affordable Care Act and to assault Medicaid that serves so many in our communities. House Democrats are prepared to defend the ACA and the millions of Americans who rely on it for health insurance. With that, I yield to Vice Chair Ted Lieu.
Thank you, Chairman Aguilar, and thank you for your leadership. Today, we celebrate the 13th anniversary of the Affordable Care Act. This law has reduced the uninsured rate by nearly half. It has saved lives. And last term, when Democrats were in control, we strengthened healthcare. We capped insulin at $35 for Medicare beneficiaries. And this year, under the leadership of President Biden, he has gotten a number of drug companies to cap insulin at $35 for non-Medicare beneficiaries. What have Republicans done when they took control? Well, they spent the resources of the committee staff, the time and attention of their members to hold not one, but two congressional hearings complaining about Twitter. They also took turns to read the Constitution on the House floor. How does that help the American family? It doesn't. What we want to do is make sure that we continue to strengthen healthcare, and that's why we're celebrating the ACA today. And we have two amazing members with us, Jill Takuda and Glenn Ivey. And I'm so honored to introduce Glenn. He had a distinguished career before Congress, and now I'm honored to serve with him on judiciary. He's going to tell you his story.
Thank you. Sure. Thanks, Ted. Appreciate it. Absolutely. Thank you. Good morning. My name is Glenn Ivey. I represent Maryland's 4th Congressional District, which is the suburbs on the eastern side of Washington, D.C. So I get to drive to work every day, unlike Representative Takuda, who has to fly from Hawaii. No jet lag for me. But I started actually in the 100th Congress, so just to show my age. But at that point, there was a fight to try and get health care coverage that went on for the next 30 plus years. Fortunately, with Obamacare, which is our 13th anniversary for this, I should say ACA, but I like to call it Obamacare because in the future, I want people to know how this legislation got put in place, why they have health care, and why they didn't have it before, that this is a seminal and turning point moment for them. And it was important for me because before Obamacare came into place, I had a healthcare scare. It turned out I had a high blood pressure incident, and I was taken to the hospital via ambulance. They did a check. They put me on blood pressure medication. But the doctor there said, you know, for African-American males, sometimes there's a kidney complication for that. So I'd like to do an MRI. Now, I was about to get the MRI, and I said, well, how much does that cost? And they said $5,000. So I said, I can't do that. I'm going to have to pass on the MRI. Now, fortunately, where the doctor was in the Baltimore area. I was able to come back down to the Prince George's County area where my healthcare coverage applied and get the MRI done. And I say fortunately because they found cancer in the MRI scan. And based on that, I was able to get treatment and recover fully and quickly. But I got to say, you know, I might not be here today, but for the ability to have that MRI done. And I wouldn't have gotten the MRI done, but for healthcare to pay for it. Now, there's thousands of Americans, tens of thousands of Americans who've gotten coverage, actually hundreds of thousands of Americans, or millions, I guess, who've gotten coverage. And in Prince George's County, it made a huge difference as well. I think we need to make sure we expand this on this anniversary. Remember that there are states, mainly red states, that are still fighting the expansion of Obamacare into their states. They're not explaining to their public that they're keeping them from getting health care that they need. And they're not really telling them that they're playing Russian roulette with the lives of many of their constituents. The time for that has come to pass. We need to get this done. We need to expand it. I look forward to working with my colleagues and getting that done. And now let me turn this over to my jet-lagged colleague, Representative Takuda.
Thank you, Glenn, and thanks for calling me out on the fact that I'm still 6 hours behind right now, but who's keeping track? Thank you again for including me in this press conference, and it's hard to follow Glenn's story, but it is truly a testament that his story, unfortunately, is not unique. There are so many Americans across this country that had it not been for that healthcare coverage they've received through the Affordable Care Act, could likely not live to see another day. And so today is truly important. And, you know, they often say about Hawaii, lucky you live Hawaii, right? And they're not just talking about the wonderful people, the beautiful beaches, the great food. It really comes down, in my humble opinion, to the fact that we prioritize healthcare. Hawaii is about being healthy and taking care of our people like family. You know, nearly 40 years ago, before the enactment of the Affordable Care Act, Hawaii became the first state in the country to set minimum health standards and coverage for workers. The Prepaid Health Care Act, which some of you may be familiar with, passed in 1974 and guaranteed employer-sponsored health coverage for most employees in Hawaii and capping their premiums at 1.5% of their pay. You know, I served in the Hawaii State Senate for 12 years. I walked door to door to countless people, and I will tell you that there's not many people who don't know about the Prepaid Health Care Act in Hawaii. They credit it with the fact that in many cases it has saved their lives, kept them healthy. In many ways, our Prepaid Health Care Act was the ACA before the ACA. And on March 23rd of 2010, the rest of the country finally caught up with Hawaii and figured out something we knew all along. Healthcare matters. Taking care of our people like family, it matters. And the enactment of the ACA put in place comprehensive reforms that have since made healthcare affordable, as we know, prohibited insurers from discriminating against people with pre-existing health conditions, and ensured women are guaranteed essential services. You know, Hawaii's Prepaid Healthcare Act was enacted nearly half a century ago. And today, Hawaii has some of the lowest uninsured rates in the country, with under 4% uninsured in Hawaii. And we remain one of the healthiest states, happiest states in the country as well. At the same time, I will tell you, representing a district that is 96% rural, and we've got some of the most challenged communities in the country, healthcare still is an issue. But what we know when we sit down at tables together and talk about this is that the ACA has and will continue to make a difference in their ability to access care and coverage. I once sat down in a park on Lanai, and an old man told me it's really difficult to be born and to die here. And when we talked more about what we could do together to make it a place where they could really call this home for themselves and their children, it became evident that through the Affordable Care Act provisions and what we are doing here in Congress, the fight we have, we would be able to make sure that generations of Hawaii residents across this country can rely on the care that they need to really see a life for themselves in their communities and this country. And so knowing what we know about Hawaii's example and 40 years ago, what we did through the Prepaid Health Care Act and the results that it's had on our community, let's just imagine what this country could look like in 40 years. how many millions more Americans will live longer, healthier, and happier lives, and all because comprehensive healthcare reforms we made 13 years ago with the enactment of the ACA are continue to be fought for and possible. So thank you for including me in this conversation, and we look forward to many more years of the ACA. Mahalo.
Thank you so much, Jill Takuda and Glenn Ivy, for sharing in your support of the Affordable Care Act. Questions?
Republicans are bringing their parents' Bill of Rights bill to the House floor today. What are your thoughts on that bill? Do you think that it's appropriate?
That was the subject of our caucus meeting as well, and we heard from some of our colleagues. I've got 2 public school kids. I look at a lot of the legislation that is introduced on the House floor through that prism. I know I'm not the only one up here with kids in public schools, and a lot of our colleagues also served at the local level on school boards, as well as being PTA parents as well. So there is nothing that we have more respect for than parents' voices and our community's voices. But what Republicans are doing here is ensuring that this discussion becomes highly partisan. What they want to do is continue to foment, fear in our communities. They want to spend time talking about banning books. They don't want to talk about outcomes. They don't want to talk about rising test scores, and they don't want to talk about how we put more resources and funding into our schools to ensure their success. They want to bring, partisan rhetoric and fighting into the classroom, and we don't think that's right. We think that they continue to put politics over parents, and that is the focus of this bill and this piece of legislation. Vice Chair Lieu.
Thank you. I agree with everything Chairman Aguilar said. I have 2 kids. One is in high school, and as my colleague Katie Porter would say, they're lightly supervised. Also, my wife's a school board member. We're really strong supporters of parental rights. The problem with H.R. 5 and the way Republicans wrote this bill is what it will do is it will pit parents against parents. It will let other parents increase their ability to dictate what books your child gets to read. It will increase the ability of other parents to find out if your child has an eating disorder. For other parents to find out if your child has been bullied. For other parents to find out if your child has suicidal thoughts. There are radical extreme provisions in this bill that will destroy students' privacy and let other parents know about your child. And that's why this bill is really quite outrageous if people would simply just to read the text.
Another question.
Yeah, I wanted to ask about TikTok, obviously topic of discussion on the Hill today. Curious to hear where you think your caucus is on the Restrict Act, the bill proposed by senators that the White House has endorsed that would allow Commerce to take action against TikTok, and just what the feeling of the caucus is generally on TikTok and some of the concerns that have been raised.
This is something that is being discussed, right now, I think, in Energy and Commerce. I think many of us have some ideas and some thoughts. We obviously supported legislation that required government phones not to have TikTok installed. That was a provision that I think all of us agreed with. At this point, I think we want to hear the testimony. We want to hear the discussion. We want to hear where this legislation could go, what the Energy and Commerce Committee is looking at. I think there are some aspects of the hearing today that will be bipartisan, and we look forward to reading and watching the outcome of that before I develop a position. I think the caucus is honestly in listen mode. We want to hear what the questions our colleagues have, what we want to learn, what the outlook of the company is from the witnesses, and then we'll form an opinion and decide the best policy from there.
Just a quick follow-up on that. You may be in listen mode, but there are others in your caucus who are well decided on this issue, and there are bills out there sponsored by Democrats that would ban TikTok from this country. And then Jamal Bowman and some liberals last night were saying that this company is being singled out unfairly, and just because of the connection to China, it's xenophobic. position to take to want to ban this company and not go after Facebook or anybody else. Where do you stand on that issue? Is there a coming divide here between Democrats over what to do with TikTok?
Look, there's always differences of opinion. There's also differences in timing. And I think a lot of the discussion is timing and policy. And I'll ask some of my colleagues to give their position. But I think our encouragement to our colleagues is, let's dive in. Let's see what this hearing looks like. Let's see what a markup could yield. And let's decide what's in the best interest and the best policy for this country. But there will be some members who stake positions. And that's completely fine. I think from our perspective, we want to make sure that the facts are on the table. We want to make sure that we understand what the company's position is, understand the questions that our colleagues have before we formulate a position. I would anticipate that we continue to work with Chairman Pallone. He's still my chairman, and decide what the best course is moving forward. Anyone else?
Just briefly, I'll say this. I'm in listen mode as well, but it is refreshing that our Republican colleagues have finally come forward with a hearing on something substantive. I'm about to go back to a hearing that's about abolishing the ATF. We spent an hour at a previous hearing about whether the hearing should start with the Pledge of Allegiance. There's been a lot of silliness going on, I think, based on the leadership of the Republican caucus. And I'm hoping that this signals a movement towards more serious business getting done here in the House.
On another issue, there's a report that the Air Force has revealed that 2 more Republican candidates had their information improperly released during the previous midterms. Do you have any thoughts on the situation and how that came about, or concerns whether Democratic political organizations would have potentially known about that as it was happening?
I think that's a question that's directed across the street to those political entities, but I think that there's an ongoing review from the Air Force side. There's continues to be a review of what happened, why there was a release of information, whether it violated a policy or not. I anticipate that the Air Force will act accordingly and tighten up whatever policy is needed. And if there are political questions, those would be best sent over to folks across the street on the political side. Any more? Thank you so much.
Thank you.
Mike, you want one more bite at the
Yeah,
apple? Yeah,
you mind?
sure.
All of these investigations into Donald Trump, of course, there are a number of them happening simultaneously. It sounds like the Manhattan DA might be the very first to go, and of course, those charges are much lesser than some of the others. Is it concerning, and we've heard some of your colleagues say that it is concerning, to have the lesser charges go first, just in terms of the political fallout and how that might undermine the subsequent investigations and any charges that might follow?
I'll let the local officials in New York kind of speak to their timing, but I think from the Democratic caucus perspective, there can't be 2 sets of rules. There can't be one set of rules that applies to everybody else if they break a law versus those who have served in even the highest positions in government. There has to be accountability, and there can't be 2 sets of rules that are played. And so I look forward to seeing the outcome of federal, state, and local officials in their deliberations. But I'm going to let them decide what they feel is best and let the justice system play out. I'd like to ask Vice Chair Lieu and maybe Glenn as well as Judiciary Committee members to talk about their perspective on the latest.
Chairman Aguilar, exactly right. We can't have 2 sets of rules. And what's particularly disturbing with regard to what some Republican legislators are saying, we don't even know if there are going to be charges. We don't know what those charges are going to look like, and we don't know what the grand jury evidence is. So when Republicans come out and say that DA shouldn't do X, Y, or Z, they're doing this with no basis, no evidence. And in fact, what they're really saying is you need to simply not apply the law to a person who happens to be named Donald Trump. And the one thing that they cannot explain is why they were silent when a person named Michael Cohen was arrested, indicted, convicted, and went to prison in part for participating in illegal hush money payments to Stormy Daniels. So let's wait to see if there are going to be charges. Let's see what the charges are. Let's see what the evidence is. And we should let law enforcement do their jobs without political interference. Glenn Ivey is on the Judiciary Committee if you want to say something.
Yeah, just briefly. I was astonished actually when I saw the letter from the 3 committee chairs to Mr. Bragg, essentially calling on him to violate grand jury secrecy laws in New York, which of course is a felony. He rightly declined to do that. My call was for those 3 to withdraw the letter immediately, hopefully recognizing the mistake that they had made, but that's too much to ask, I suppose. But I think it's important to let the process play out, as Congressman Lieu was just suggesting. We don't know what the grand jury is going to do in New York. I think we just have to wait and see. But that's how the process is supposed to work, whether you're a former president or just a regular person on the street under investigation. Let's let it run its course according to the law.
Thank you so much.
Good job.